I think that when you look throughout the history of military psychiatry, and this is just my perspective, all these are only my perspective, not the perspective of the Army, you'll see that we constantly evolve and develop. And there have been times in our history where in World War I, World War II, we learned lessons, and then with 30 years of without a conflict, or 20 years without a conflict, we kind of lost those lessons, and then we rediscovered them again. I think that a lot of the lessons that we've discovered, I would say that in the last 15 years we've actually rediscovered. So how we can really engage soldiers and how we can really take care of soldiers better, both downrange and at home. I think it reflects the fact that the United States Army in general is the most trusted institution in our culture. There are specifics that any one individual can agree with, but I think that people want to take care of soldiers, and that's very, very important to me because our soldiers deserve the best possible care. They are one of the most deserving patient populations, in my opinion, because of what they sacrifice. And I think that people recognize that, and that's the reason why there's that resonance. It really makes me glad that other psychiatrists, if they're either working in the DoD system as a civilian contractor, if they're thinking about wearing the uniform, if they're just wanting to take care of soldiers or veterans who are in their communities, want to learn more about this specific subpopulation. And that's really what we are in the military, is a subpopulation with our own cultures, with our own practices. We have our own language in a way. We have acronyms that we can talk to each other, and other people might not know. We're not trying to hide what we're saying, but other people might not know the acronyms that we just don't even think about using. I would encourage any psychiatrist, any behavioral health provider to just learn more about the culture, talk to a soldier about the culture, talk to military psychiatrists. We're happy to talk to you about how you can help or enhance your treatment of the specific population in our society. My focus is taking care of the soldier. There are sacrifices, I think, that come along with being a military psychiatrist. There are also, like anything else in life, there are also joys too. But there are times that we need to have a time apart from our family for a while. That would probably be the most obvious sacrifice that I think is associated with being a military psychiatrist. But it's worth it because of taking care of soldiers is such an important mission. And it's almost, in my mind, almost a sacred mission. And I get a lot of purpose from that. So really, being a military psychiatrist is all about, the focus is on good soldier care. I think the future of this field is undetermined. I think that we need to continue to look into evidence-based medicine and see exactly what therapies are effective. I think that we are engaging in research in military medicine and the VA and even in civilian institutions about lots of topics that are important to military psychiatry. PTSD is one, but there are others as well. And so just, I think, putting an emphasis on research and making sure that what we're doing is doing what we think it's doing, I think that's going to be one of the ways to head into a good future for military psychiatry.